Welcome to the deep dive. Today we're plunging into something that, well, on the surface seems pretty common. A pet with a runny nose who just can't stop sneezing. But as always, the sources we've pulled show there's often a lot more going on than meets the eye. We've got a stack of detailed veterinary articles, research papers covering rhinitis and sinusitis in dogs and cats. These are the conditions behind those snotty snoots and persistent sneezes. Our mission in this deep dive, to kind of cut through the complexity, pull out most crucial insights, and really understand the why and the how behind these issues. Because, sometimes it's simple and sometimes, well, it's a much deeper problem.
And that's absolutely the critical takeaway the sources really drive home. While, yeah, a sneeze or some nasal discharge might seem minor, they can actually be red flags for pretty significant underlying diseases. These aren't just cosmetic issues. They can profoundly impact a pet's quality of life. And if they're not diagnosed and treated correctly, they can lead to some severe complications. We're going to explore that full spectrum, from the easily resolved acute problems right through to the really challenging chronic conditions.
All right, let's start at the beginning then. What are we actually talking about when we say rhinitis and sinusitis? What's the basic definition here?
Okay, so simply put, rhinitis is inflammation of the lining of the nasal passages, that's the nasal mucosa. And sinusitis is inflammation of the paranasal sinuses. The sources specify that in dogs, these are primarily the frontal sinus and the maxillary recess, whereas in cats, it's the frontal and sphenopalatine sinuses. And because the nasal cavity connects directly to these sinuses, inflammation in one often leads to inflammation in the other. That's why you often hear the term rhinosinusitis. They're frequently a package deal.
Okay, so inflammation, right. But how does that inflammation actually turn into the snot and sneezing we see? What's happening inside?
Think of it like this. The inflammation irritates that nasal lining, and this irritation stimulates the glands there to produce fluid. Initially, this discharge is usually thin, clear, watery, what we call serous discharge. But if the inflammation persists or becomes chronic, the protective barrier of the nasal lining gets damaged. And this allows opportunistic bacteria, the ones that are normally there, to multiply and cause a secondary infection. Yeah, and when that happens, the discharge changes. It becomes thicker, maybe sticky, it's mucoid or even pus-like, which is mucopurulent. And in more severe cases, the inflammatory process can actually start to destroy the delicate structures inside the nose, like the turbinates.
Turbinates, those are the scrolly things.
Exactly, those complex scroll-shaped bones that warm and humidify the air. And this destruction, along with damage to blood vessels, is what can cause epistaxis or, nosebleeds.
Wow, destroying the turbinates.
Yeah.
That sounds pretty serious. And it's not just confined to the nose then, is it? The sources mention connections to other parts of the body.
Absolutely, that's a key point. While the main signs are nasal, the sources point out significant potential implications elsewhere. One of the most alarming connections is to the nervous system. If a fungal infection or maybe a tumor is aggressive enough, it can erode through the cribriform plate, that delicate sieve-like bone at the back of the nasal cavity, and actually invade the brain.
Oh, wow.
Yeah, that is, of course, a very serious, potentially life-threatening complication. Ocular signs, eye signs, are also common because the tear ducts connect right into the nasal passages. So you might see excessive tearing, epiphora, if a tear duct gets blocked by inflammation, or conjunctivitis red, inflamed eyes.
Okay.
In cats, especially with feline herpes virus, FHV1, you can even see corneal ulcers. And systemic diseases like canine distemper or cryptococcus can cause more widespread eye issues, like chorioretinitis. The oral cavity is also directly linked.
Like with teeth.
Exactly. Dental disease, like a tooth root abscess on an upper tooth, can erode right into the nasal cavity and cause nasal discharge. Oronasal fistulas, basically holes between the mouth and nose, or even oral ulcers, which are common with feline calicivirus, FCV, can be associated with nasal signs too.
So it's definitely more than just a simple cold. Is this something any dog or cat can get randomly, or are there certain risk factors that make it more likely?
Well, it's definitely not random. The sources show some pretty clear patterns on who is more susceptible to certain causes. For instance, true primary bacterial rhinosinusitis, where bacteria are the first problem, is surprisingly uncommon. What's much more frequent is a secondary bacterial infection. It basically takes advantage of a damaged or unhealthy nasal environment, often caused by something else entirely, like, say, dental disease.
Right.
Chronic rhinosinusitis is a big problem, and is particularly common in cats. Now, in dogs, if we're talking about persistent chronic issues, neoplasia tumors, inflammatory conditions like lymphoplasmacytic rhinitis, and fungal infections are high on the list of suspects. And foreign bodies, like a piece of grass seed sniffed up, they're a classic cause of sudden acute signs, especially in younger, curious dogs.
Okay. Are there specific breeds or ages that seem more prone to certain problems?
Yes, absolutely. The signalment, the species, breed, age, and sex gives us crucial clues. Obviously, both dogs and cats get these problems, but breed definitely matters. Brachycephalic cats, those cute, flat-faced breeds, are often predisposed to chronic rhinitis just because of their anatomy. And interestingly, the sources mention them as more prone to Aspergillus fungal infections than other cats.
Huh, interesting.
Yeah, and then long-nosed dogs, the dolichocephalics like collies or greyhounds, they seem more susceptible to fungal infections like Aspergillus and also nasal tumors. And well, as you might guess, their long snoots are just great at vacuuming out foreign bodies.
Makes sense.
Age is also a major factor. Very young kittens, say around 6 to 12 weeks, that's the prime age for acute viral rhinosinusitis and also nasopharyngeal polyps. Congenital issues like a cleft palate or problems with cilia, those tiny hairs that sweeten mucus out, are typically seen in young animals. On the flip side, neoplasia and dental disease, those are usually problems of older pets. And again, foreign bodies are just more common in younger, actively exploring dogs. Sex doesn't really seem to play a significant role based on what the sources say.
Okay, so what should someone watching or listening be looking for in their own pet? What are the key signs they might notice?
So the historical signs you typically notice are things like sneezing, nasal discharge, and potentially epistaxis nosebleeds. The discharge itself can tell you quite a bit. Like we mentioned, it often starts watery, serious, and then with time or secondary infection, it becomes thicker, cloudy, maybe yellowish or greenish that's mucoid to mucopurulent. If it's bloody or just tinged with blood serosanguinous or hemorrhagic, that's definitely a more specific sign that needs prompt attention.
And this is a really important point the sources highlight. Is the discharge coming from just one nostril or both? Why is that distinction so crucial?
Yeah, this is a major diagnostic differentiator.
Yeah.
If the discharge is unilateral, just coming from one side, it strongly suggests a localized problem on that side. Think foreign body lodged in one passage, maybe a tooth root abscess eroding into the nasal cavity from one side, or even early neoplasia or fungal infection before it spreads. Interestingly, idiopathic inflammatory rhinitis can also sometimes start on just one side.
Okay.
Now, if the discharge is bilateral coming from both nostrils, it points towards a more widespread or diffuse issue affecting both sides, or maybe even a systemic problem. This is really common with viral or bacterial rhinosinusitis, inflammatory conditions affecting the entire nasal cavity, or problems back in the nasopharynx impacting both sides. However, it's important to remember that a unilateral problem, like a tumor or a fungal infection that's been there for a while, can eventually become bilateral as it grows and spreads. So unilateral tends to scream localized, while bilateral suggests widespread.
That's a fantastic clue. What about things a vet might find during a physical exam? What are they looking for?
Right, so beyond just observing the discharge, a vet will actively look for other clues. Checking nasal airflow from each nostril is important if it's reduced on one or both sides. That indicates some kind of obstruction. A thorough oral exam is absolutely essential, looking for those tooth root abscesses or nasal fistulas, cleft palates, or ulcers we talked about.
Right, checking the mouth.
Exactly. They'll check the eyes for epiphora or conjunctivitis. They might palpate the face, feeling for any swelling or pain, which is often a sign of fungal disease, or maybe a tumor involving the bone. Reverse sneezing, that weird snorting inhale, is common in dogs and often suggests irritation back in the nasopharynx, the area behind the soft palate. Other signs might include the pet pawing at their face, maybe a reduced sense of smell, or even anorexia, loss of appetite. This is especially common in cats because, they rely so heavily on smell to stimulate their appetite.
Good point.
Yeah. Straler, which is a snoring-like sound, can indicate obstruction. Sometimes postnasal drip can cause coughing or gagging, and there are even some sort of classic signs like depigmentation, loss of color on the top of the nose, which is highly suggestive of Aspergillus in dogs, or that facial swelling giving a Roman nose profile, which can be seen with neoplasia or cryptococcus in cats.
Okay, so we've got the signs and who's more likely to get them. Now for the really big question. What's actually causing all this? The sources really lay out a huge list of possibilities.
Yeah, this is where the deep dive gets really interesting, connecting those signs back to the root cause. And yes, the list is pretty extensive and, importantly, often different between dogs and cats. Okay, so for dogs, some of the primary causes include fungal infections. Aspergillus fumigatus is the most common one, and it's often very destructive to those turbinate bones we mentioned.
Right, the destructive one.
Yeah. Tooth root abscesses are a surprisingly common cause that erodes upwards into the nasal cavity. Foreign bodies are very frequent, especially in younger, adventurous dogs, causing acute and often unilateral signs. Congenital problems like a cleft palate or primary ciliary dyskinesia, where the little hairs don't sweep properly, can cause issues right from a young age. Parasites like nasal mites, Pneumatosoides caninum, are also possibilities the sources mention. Neoplasia tumors are a major concern, particularly in older dogs. Adenocarcinoma is the most common type, but others like lymphoma, chondrosarcoma, and osteosarcoma occur. These are typically unilateral, at least initially, and progressive.
And immune issues.
All right, immune-mediated conditions exist too, like allergic rhinitis, though maybe less common than in people, and idiopathic lymphoplasmacytic rhinitis. That last one is basically chronic inflammation with no identifiable cause. It's often a diagnosis of exclusion, meaning you rule everything else out first. Other infections like canine distemper or Bordetella bronchoseptica can play a role, but the sources specifically state Bartonella is not linked to rhinitis or sinusitis. And local trauma can sometimes set the stage for chronic issues or secondary infections like Aspergillus. Beyond those primary nasal problems, secondary causes in dogs can include things like lower airway disease like pneumonia, or even vomiting if material gets aspirated back into the nasopharynx. Eosinophilic bronchopneumonopathy, a specific lung condition, can also cause nasal discharge. And epistaxis, those nosebleeds, can be a symptom of systemic issues like high blood pressure, hypertension, low platelet counts, thrombocytopenia, or other bleeding disorders, coagulopathies, not just local trauma or foreign bodies.
Okay, so that's dogs. What about cats? The picture changes.
It really does. Now, shifting to cats, viral infections are huge drivers, especially in young cats. Feline herpes virus 1, FHV1, and calicivirus, FCV, are responsible for the vast majority, like 90% of acute infections in kittens. And what's really critical to understand is that FHV1 often causes long-term turbinate damage during that initial infection. This damage then predisposes cats to chronic recurrent rhinosinusitis throughout their lives.
Ah, so the initial infection has lasting effects.
Exactly. Plus, these viruses have latency and reactivation, meaning the signs can kind of wax and wane over time. FCV also notoriously causes those painful oral ulcers. Bacterial infections like Bordetella bronchoseptica can occur, but their role as primary causes is less certain. Secondary bacterial infections are super common on damaged feline nasal mucosa. Again, the sources state Bartonella is not associated. Neoplasia in cats includes adenocarcinoma and lymphoma, similar to dogs. Fungal infections are different, though. Cryptococcus neoformans is the most common fungal culprit in cats. That's the one that can cause that facial swelling, the Roman nose, and it can even affect other body systems. Aspergillus felis occurs, but is less common than canine Aspergillus.
And polyps, you mentioned those earlier.
Yes. Nasopharyngeal polyps are surprisingly common, especially in young cats. They usually originate from the eustachian tube or the middle ear and grow down into the nasopharynx, causing obstruction. Nasopharyngeal webbing or stenosis, which is a narrowing behind the soft palate, can be congenital or develop due to severe chronic inflammation. Dental issues, abscesses, fistulas, and foreign bodies are also possibilities in cats, as are congenital problems like cleft palate. And secondary causes in cats also include things like coagulopathy or hypertension causing nosebleeds or aspiration of vomitus.
Okay, so comparing them.
Yeah, if we compare them quickly. Viral infections, particularly FHV1, are major long-term players in cats, leading to chronic issues, whereas primary viral causes in dogs are less likely to cause lifelong rhinitis. Aspergillus is the big fungal bad guy in dogs, while Cryptococcus is the main one you think about in cats, those inflammatory polyps, largely a young cat phenomenon. And foreign bodies seem to be more of a dog thing, probably just due to their sniffing behavior. It's definitely a complex puzzle, and the species makes a big difference in what pieces you look for first.
That is quite a list. So, given all these potential causes, viruses, fungi, bad teeth, foreign objects, how does a vet even begin to figure out exactly what's going on, especially if it's chronic?
Right. The sources really emphasize that a methodical, stepwise approach is crucial, particularly for those chronic cases. You generally start with the less invasive things and then move towards the more advanced diagnostics, which, often require the pet to be under general anesthesia. So initial steps, often done with the pet awake, include that really thorough history and physical exam we talked about. That oral exam and checking nasal airflow are absolutely key. Routine blood work, a CBC, chemistry panel, and urinalysis are typically done. They might not give you the specific answer for the nose, but they help rule out other systemic problems and, importantly, assess the pet's overall health and suitability for anesthesia if it's needed later.
And for cats, the FIV-LV test.
Definitely. For cats, FIV-LV testing is important. Then specific tests might be run if a particular cause is highly suspected. Things like a cryptococcal antigen titer, if you suspect Cryptococcus, or Aspergillus titers, though the sources do note that the AGID test for Aspergillus in dogs can have limitations, and the ELISA in cats is still maybe more for research settings. If there's epistaxis, a coagulation profile to check for bleeding disorders is vital. Viral PCR, looking for viral DNA or RNA, can be done on swabs in cats. But you have to remember, a positive result for FHV1 or FCV doesn't automatically mean it's the active cause of the current signs because of that latency issue.
Right, it could just be hanging out.
Exactly. Cytology of the nasal discharge itself is often done, but unfortunately, it's frequently nonspecific. Doesn't usually pinpoint the cause.
Okay, so that's the initial stuff. What about the more advanced diagnostics under anesthesia?
Right, so for more definitive diagnoses, you usually need general anesthesia to get a really good look or get good samples. Imaging is key here. A CT scan computed tomography is really considered the gold standard, and the sources explain why. It gives vastly superior detail of bone. It can show things like turbinate destruction, how far the disease extends into the sinuses, if there's a foreign body, any dental involvement, and critically, whether that cribriform plate separating the nose and brain is intact.
Better than x-rays then.
Much better. Radiography, regular x-rays can be useful, especially dental x-rays for tooth issues. But standard nasal x-rays are often limited because all those structures overlap, making it hard to see detail. You need specific open-mouth views to see the nasal passages better. But even then, CT is just way better for showing soft tissue masses or subtle bone changes. Then there's endoscopy, specifically rhinoscopy. This is another incredibly valuable tool, also done under anesthesia. Antegrade rhinoscopy means putting a scope up the nostrils to see the front part of the nasal passages. Retrograde rhinoscopy involves putting a scope behind the soft palate to see the nasopharynx, the back part.
And you can see things directly.
Yeah.
Exactly. It allows for direct visualization of lesions, foreign bodies, polyps, whatever might be there. And importantly, it provides a way to get targeted biopsies under guidance. This is much better and safer than doing a blind biopsy with forceps, which carries that small risk of accidentally hitting the cribriform plate. Nasal flushing, or lavage, is also done under anesthesia. Saline is flushed through the nasal passages and collected the back of the throat, the pharynx, is packed off first to prevent aspiration. This fluid is sent for cytology or culture. Although the sources mention bacterial culture is sometimes controversial because chronic rhinitis often leads to secondary bacterial colonization that might not even be the primary problem. Got it.
Biopsy and histopathology, looking at the tissue under a microscope, are essential for a definitive diagnosis in many cases. It tells you the type of inflammation, confirms fungus, or identifies neoplasia. More invasive surgery, like an exploratory rhinotomy, actually opening up the nose surgically, is rarely needed for diagnosis anymore. It's mostly reserved for removing things like foreign bodies or masses that just can't be accessed endoscopically. Other tests might include checking arterial blood pressure if hypertension is suspected as a cause of nosebleeds, or maybe aspirating lymph nodes to check for spread of neoplasia or cryptococcus.
So, quite the diagnostic journey indeed. Once you finally get a diagnosis, what are the options for treatment? I know the sources stress that treatment is really specific to the cause.
Exactly right. You absolutely can't treat a foreign body the same way you treat a fungal infection or a tumor. It has to be tailored. Supportive care is kind of the starting point, and it's helpful in almost all cases, even while you're still working towards a diagnosis. This includes things like humidification or nebulization, using steam or mist to help loosen those secretions. Using saline nasal drops can help too, if the pet tolerates them. Keeping the nares clean so they don't get all crusted over is important. Ensuring the pet eats and drinks adequately is crucial, especially for cats whose appetite is so linked to their sense of smell.
Right. Got to keep them eating.
Yeah. And managing the environment by reducing irritants like smoke or dusty litter can make a difference too.
Okay, so that's supportive. What about specific therapies?
Okay, then we get into the specific therapies based on the actual diagnosis. For bacterial infections, antibiotics are used. Often they're started empirically, based on suspicion. And chronic cases often need really long courses, 4 to 8 weeks, sometimes even longer. But, and this is a big but, recurrence is really common if the underlying cause that allowed the bacteria to take hold in the first place isn't addressed. And it's worth repeating. Just finding bacteria in chronic rhinitis doesn't automatically mean long-term antibiotics are the answer if there's another primary cause driving it.
Right, got to fix the root cause.
Exactly. Now, fungal infections require antifungals. For Cryptococcus in cats, systemic antifungals like itraconazole or fluconazole are typically the way to go.
Mhm.
For aspergillus in dogs, systemic itraconazole might be used, but local antifungal infusions putting the drug directly into the nasal cavity and sinuses, drugs like clotrimazole or enilconazole, are often much more effective. However, and this is critical, this local treatment can only be done if that cribriform plate is intact. And it often requires a surgical procedure like trephination, making small holes in the bone to place catheters for the infusion.
Okay, so that's a bit more involved.
Definitely. Allergic rhinitis might involve trying to avoid the allergen, using antihistamines or maybe steroids, although the sources caution strongly against chronic steroid use because it suppresses the immune system, and particularly in cats, it can reactivate latent FHV1, potentially making things worse, not better. Immunotherapy might be an option for long-term allergic management. If it's a foreign body, well, removal is the treatment, ideally using rhinoscopy or surgery if necessary. Dental disease. That's treated by fixing the tooth, usually extraction or maybe a root canal, and repairing any oronasal fistula that's formed.
And the more serious things, like tumors.
Right. Neoplasia often has a more guarded prognosis. Radiation therapy is frequently used, and the sources indicate it's often the most effective treatment for palliation, improving quality of life and extending survival time. Chemotherapy or surgery might also be used, but surgical removal alone is rarely curative for malignant nasal tumors. Nasopharyngeal polyps are removed surgically, often by gentle traction if they're accessible, or for those originating deeper in the middle ear, via a procedure called a ventral bulla osteotomy, basically surgically opening the bony structure of the middle ear. Recurrence is possible with polyps, unfortunately.
And that tricky idiopathic one.
Ah, yes, idiopathic lymphoplasmacytic rhinitis. This is one of the most frustrating ones for vets and owners. It's very challenging to eliminate, often requiring lifelong management just to control the signs. This might involve various medications like steroids, used judiciously, immunomodulators such as cyclosporine, and maybe intermittent antibiotics during flare-ups, plus all that supportive care like nasal lavage and humidification. Referral to a specialist is often recommended for these tough cases. And of course, there are antiparasitics if nasal bites are diagnosed.
And the sources specifically call out some cautions regarding medications, didn't they?
Yes, some critical cautions. Avoid long-term steroid use because of the immune suppression risk and potential for worsening other conditions like FHV1. Absolutely do not combine NSAIDs, non-steroidal anti-inflammatory drugs like meloxicam or carprofen with corticosteroids. That combination carries a major risk for severe gastrointestinal side effects.
Good to know.
Yeah, very important. And tetracycline antibiotics should be avoided in young growing animals because they can cause permanent staining of their developing teeth.
So after going through all this diagnosis and treatment, what's the expected outcome? What does the prognosis generally look like for these pets?
Well, the prognosis varies dramatically. It truly depends entirely on the underlying cause and, frankly, how advanced it is when it's diagnosed. For simple, acute viral or maybe bacterial rhinitis, the prognosis is generally good. It often resolves with time and appropriate supportive care. If it's a foreign body, the prognosis is excellent if it's removed promptly and completely before causing too much damage. Fungal infections vary. Aspergillus in dogs, if treated aggressively with that local therapy and maybe surgical debridement, often has a good to excellent prognosis. Cryptococcus in cats has a more variable prognosis, but is often good with systemic antifungal therapy, although relapses can definitely occur down the road. Dental disease causing nasal signs generally has a good prognosis once the dental issue is properly treated.
But less good for some others.
Unfortunately, yes. For neoplasia, the prognosis is generally guarded to poor. The sources cite median survival times without treatment being quite short, maybe only 3 to 5 months. Radiation therapy can significantly improve this, potentially extending life into the 9 to 23-month range, offering valuable quality time, but it's rarely a cure. For that idiopathic lymphoplasmacytic rhinitis, the prognosis for a cure is guarded, meaning unlikely. The goal there is often focused on long-term management and maintaining a good quality of life, understanding it's likely a lifelong condition to manage. Inflammatory polyps generally have a good prognosis with surgical removal, but you always have to keep in mind that recurrence is a possibility.
It really sounds like getting the right diagnosis makes all the difference in the world for the prognosis and treatment plan. And the sources mention that vaccination in kittens is important for prevention.
Absolutely. Vaccination against feline herpesvirus and calicivirus in kittens is crucial. It might not prevent infection entirely, but it can significantly reduce the severity and duration of those initial acute viral infections. And that in turn can potentially lessen the risk of developing that chronic post-viral rhinitis later in life. And yeah, the sources do reinforce those potential serious complications we touched on, like aggressive fungal or neoplastic diseases invading the brain through the cribriform plate. They specifically caution that if you use those topical antifungals when the cribriform plate is already damaged, there's a real risk of the drug getting into the brain and causing severe neurologic signs, including seizures. So knowing if that plate is intact via CT is critical before certain treatments.
Wow. We started talking about just a simple runny nose, and we ended up covering everything from, dental disease eroding up into the nose to fungal infections potentially invading the brain. That was a truly comprehensive look at what seems like such a simple problem on the surface.
It really is, isn't it? As the sources so clearly show, a seemingly benign sign, like a bit of sneezing or some nasal discharge, can be anything from a mild, self-limiting issue that clears up on its own, to a signal of a complex, potentially devastating disease requiring specialized diagnostics and sometimes lifelong care.
It definitely highlights just how important a thorough investigation is when those nasal signs become chronic or severe or change in character rather than just, throwing antibiotics at it and hoping for the best.
Exactly. Understanding that wide range of potential causes, from the common viral culprits in kittens to surprising things like foreign bodies, dental disease, specific fungi, or even tumors, is absolutely foundational. It's the key to getting the right diagnosis and therefore getting onto the correct path for treatment. And also recognizing that for some conditions, like that chronic inflammatory rhinitis, the journey might be more about managing the signs and maintaining comfort and quality of life, rather than achieving a complete cure. That's important for setting expectations, too.
So, pulling all of this together, what does this deep dive mean for you listening? Here's a provocative thought to maybe leave you with. Considering just how many different things can cause nasal signs in your pet, and how some of those like untreated dental issues or certain infections can start out looking pretty localized but then escalate into really serious problems, how does this knowledge change your perspective the next time your dog or cat just starts sniffling or sneezing a bit more than usual? Something to think about. That wraps up this deep dive. Thanks so much for joining us.